Hi friends, welcome to Kriba's Center for Nursing Education and Service. Today we'll be dealing with an interesting topic, that is statistics in nursing. In this session we are dealing various concepts related to statistics, like various definitions and its meaning and other related concepts in statistics, and how we use statistics in nursing and the measures used in statistics. First, let us see the definition on statistics. It is defined as the science of figure with techniques and method of collection, classification, summarization, interpretation of data, and making recommendation to needed change at individual level or society. It's nothing else, a fact and figure which is collected by a method. After its collection, it is classified, summarized, and interpreted for making various changes. Let's see one more definition of statistics. It's defined by Best and Can as the body of mathematical technique or process of gathering, organizing, analyzing, and interpreting the numerical data. Let's see what you mean by biostatistics then. It's nothing else, application of statistical technique in the field of health science like biology, medicine, nursing, and public health. The other related concepts under statistics, they are first and foremost is data. What do you mean by data? It's the fact or observation or the information collected by an investigator for the purposes of investigation. There are various different types of data we use commonly, that is quantitative data or qualitative data or categorical data. Quantitative data means the data collected by using some instrument to measure something. For example, test score, pre-test and post-test score, or the weight gain before or after, or the weight gain of a normal baby, etc. Whereas qualitative data means according to their properties, we are collecting the data and they are grouped like male or female, vehicle type, etc. The other way, variable. It's the property of an object or event that can take different values. For example, in a college, the major subject like we call it, but it can vary, like mathematics in particular group, computer science for other specialized, English for some other group. So that's variable. It can vary, or the object or event, it can take any values. There are different types of variables: discrete variable and continuous variable. What do you mean by discrete variable? A variable with a limited number of values, like male or female in case of gender, junior or senior, like that way, with limited values. Whereas continuous variables means it can take on many different values in theory, and values varies between lowest and highest point on the measurement scale. The other variable is independent variable. That is the variable that is manipulated, measured, or selected by a researcher, like cause and effect. In that, independent variable means it is the cause, and dependent variable is the outcome effect. So we can see dependent variable. It is the variable which is observed and measured in response to independent variable. Next is qualitative variable and quantitative variable. Quality means qualitative variable is based on the categorical data, and quantitative variable means based on the quantitative data. The other important concepts under the statistics is the graphs. This is used for displaying the data for the visual to present frequency distribution so that people can understand very easily. The other one is central tendency. That is, collected data are distributed and that take a shape which give a general sense that how it is bunched and organized. Majority of the data will have the tendency to be in the center, and the tendency of the data to be towards the center is known as the center tendency. And the common central measures of central tendencies are mean, median, and mode. Spread or variability. It provides information about the degree to which individual scores are clustered about or deviate from the average value. Example, standard deviation, mean deviation, range. The other one is measure of shape. Summarizing the data from continuous measurement scale, it is used how the distribution rises and drops, like kurtosis, skewness, symmetry, all this comes under this category. Next is about the population. It's a complete set of person or object that poses with common characteristic, which is the interest of the researcher. An observation is the method by which data are collected through visually. And sample is the subset of the population that is selected to represent the population. Next, let's see how the statistics is benefited by us. If we see in the field of education, nursing service and nursing administration, statistics have an important role. And based on the statistics, the education status of an institution can take an appropriate measures to improve themselves or modify their way of dealing, etc. Similarly, in the service side, the statistics collected based on the vital statistics or any related with patient statistics and the customer satisfaction, or whatever it may be, it have an impact in the service, and based on this data, the service can be improved in order to provide quality service. Similarly, the nurse administrator can take important decisions based on the statistics. So the statisticians have a very great role in the field of nursing as like any other life science. Next we shall see the different measures used in the step. Commonly we use 4 general categories of measurements. These levels of or the scales of measurements are nominal, ordinal, interval and ratio. Remember, the levels or the scale of measurements used in statistics are nominal, ordinal, interval or ratio. Let's see what you mean by nominal scale. It is nothing else the measurement of named category data. And numbers are used simply to identify the data only. And remember, is the lowest level of measurement. In the scale of measurement, the data is assigned to a category and there is no order at all except for alphabetical order. So it is the lowest level of measurement and numbers are used just to identify the data. For example, hemoglobin level, BP, based on the religion, how the category of people are or based on the blood group, how the people are categorized. And the possible statistical operation used are frequency and percentage. Next measure or the level of measurement is ordinal scale. It is a set of ordered data. The difference is there is an order or category is there. And this is only the order is given, but there is no like. It's just next level of measurement. And objects are sorted based on the attribute. And the numbers are assigned based on the order of position to indicate its relative position. Like ranking. But there is no equal distribution between the group on the scale at all. Just orderly it is arranged, but there is no particular, only the ranking it is done. Example, the patient status based on like improvement, like progress, like whether the patient is stable, improved, unimproved. We cannot categorize, then we cannot, there is a particular scale is not there at all. Similarly, staging of cancer like stage 1, stage 2, stage 3, stage 4, etc. And the possible statistical operations we use here are the median, percentile, nominal, rank correlation, etc. Next level is interval scale. It is the scale where difference between two variables is meaningful, and this difference between two variables are actual and equal distance. It is the next or the third level of measurement. But remember, position of 0 point is arbitrary. That means It's not value at all. Example, degree of temperature. Whereas the ratio scale, it is the highest level of measurement. It possesses 0 point or the character of origin and unique feature. It does not have negative number and constant interval size through 0 point, and order is there, equal interval. So, to conclude, we discuss points like definitions on statistics, by statistics, related concepts like variables, data, graphs, central tendency, all those things. Next, we discuss about scope or uses of statistics, approaches of or the measures or the levels of measures in the statistics. For further reference, you can refer these books. If you find this is useful, please like it and subscribe so that you will get a notification in future when I have taught